but you'd probably be disgusted. The pieces of food come up whole. Anyway, to get back to what I was talking about, the antibiotics when the tote got sick. I used the penicillin on him, and I kept pouring fluids down his throat as well. I didn't know how to do sub-Q fluids at the time. That was something I learned later from Dr. Audrey Hayes, who was an active Abyssinian breeder in the cat fancy, and who taught a lot of us various techniques that we still use today. Well, Drummer just went into the kitchen, and he's at the food dish. But to continue, until somebody else comes along, like Cha-Cha, who's passing through, and she's going to go sit on my wheelie. She has severe IBD, and it's almost impossible to get medicine into her. She eats well, and her diarrhea is pretty much under control. She's not walking around dripping the way she was. Still, she looks ratty all the time. Let's see if I can get a better... I'm sorry. I can't seem to get a better focus here. So, and I'm probably driving you nuts with the quivering of the camera and also the jumping around of subject. Well, maybe that's a little bit better. Her face is dirty, of course, because she's had it in the can of cat food, licking out the food that was left in the can. That's her favorite thing to do. Anyway, back to the antibiotic. Penicillin was the only thing that we really had that worked at the time. And thank goddess, my boy did recover. Not too long afterwards, when I moved to Port Jefferson, I had my first litter of kittens. The cat's name was Shazadi, and she came from a breeder up in New Hampshire. Where you going, Drum? You're not going to hang around? Drummer? Drummer? Gonna hang around? How about it? Anyway, we had her first litter of kittens, and Shazadi got sick, and of course so did her kittens. And they were infants. There was very little I could do. Someone told me about a medicine called, what was it, chlormycetin palmitate. I think that's what it was called, chloramphenicol. And I was able to get that, but it was really too late. Zadie and the kittens couldn't breathe. They had such stuffed up noses that they literally were gasping and trying to breathe through their mouths, which cats don't do readily. So I called my father, who of course had been in the duck business for many years, although he had also been out of the duck business and into the nursery business, which trees and shrubs, that is, since the late 50s. And Dad said that our carpenter, an older man who had worked for Dad for a lot of years, in fact, since he had come back from the war, told him that fresh catnip was often effective for cats that had difficulty breathing. So off I went to get fresh catnip from the farm where it grew freely, and I brought bunches of it back and packed it around the cat and kittens. And it did work for Shazadi. Unfortunately, it didn't work for the kittens, and I lost the whole litter. It did help Zadi to breathe. So keep that in mind next time you have a cat who has difficulty breathing, who has asthma, who has a cold. That fresh catnip works as an antihistamine. It's a natural antihistamine for cats. So, penicillin, chlormycetin palmitate, and catnip. 3 basic medications that we used for cats back in the 70s. Now, chlormycetin palmitate came off the American market because it caused bone marrow problems in children. And so the USDA took it off the market. However, we could still get it in Mexico, so some of us would go to Mexico or ask our friends to go to Mexico and get it for us and then bring it back or mail it to us, which they did. It's still available today in a different form, and people still use it for their cats. But that oral medication, which was white and thick, was the most effective, and I wish we could still get it today. It doesn't have the same effect on bone marrow in cats as it does on children, apparently. As for penicillin, it's my go-to medication and has been for years. It's still the most effective medication against most upper respiratory infections that are bacterial, not viral. And at least I've found it to be the most effective as a sub-Q shot. I've used it over and over the years, and my cats have benefited from it. Oral medications have a tendency to be spit all over the place, including all over me or whatever furniture or whatever happens to be around them, and it doesn't go into their tummies. It goes everywhere else instead. And pills are very, very difficult for most people. They're difficult for me as a breeder, even after all these years, with certain cats. Certain cats, you can't get a pill down. I don't care how hard you try. It's good that some medications are available as, what are they called? They come in a liquid or a gel, or a paste that you can rub into the ear, and they're absorbed by the skin. Now the word escapes me, but I know that some of you know what that word is. So you can fill it in here, and if any of you feel like it, you can let me know what it is, because I just can't think of it at the moment. If the vet doesn't have these medications, you can have them made by a pharmacist who specializes in making them. Oh dear, I wish I could think of the right word. But in any case, that covers pretty much most of what I wanted to say about the medications. There's also black salve, which is a horse ointment called ichthymol, and it's not spelled the way it sounds. I keep trying to spell it every time I get it wrong. Have to look at the tube. But for wounds that suppurate, and won't heal.